and toss it over to Katie Calhoun. She is an assistant professor in the College of Social Work at Ohio State who's been working really closely on the Denver Basic Income Project, which is a leader in the guaranteed income space, especially for people experiencing homelessness. And she's going to give us a little bit of overview of her research. So I'll pass it over to you, Katie. Thanks for being here.
Yeah, thanks so much, Leah. All right, so let me share my screen. No matter how many times I've done this over the past couple of years, it always feels like it takes me a second to make sure I get it right. So, all right, can you all see the full slide, not the notes? Okay, excellent. Hello, everyone. I'm so happy to be here. This feels like a group that I probably should be a part of regularly, so I'm excited to kind of jump in today and hopefully continue conversations into the future. So, like Leah said, I'm going to cover guaranteed income specifically as a response to homelessness and focusing on the Denver Basic Income Project, which is a 12, see, I have to stop myself already. It's a guaranteed income project for folks who are unhoused in Denver. I started to say a 12-month project, and it has been extended for an additional six months as of now. I will also say before I jump in that we are going to be releasing the first year of findings this summer. So what I'm talking about today are like our preliminary findings, findings from the first 6 months of the project, but just in the next couple of months, we'll be releasing the first 12 months of the project. And you can go to denverbasicincomeproject.com, and that's where those the reports will be housed once they're published. So jumping in, I'm going to give a little bit of an introduction to direct cash transfers, just being in this space. I'm not going to go into a lot of detail. I think there are people who are much more content experts on direct cash transfers and guaranteed income than me, but I just want to kind of level set, make sure we all have some shared language. I'll talk about cash transfers specifically as a response to homelessness, and then dive into the specifics of the Denver Basic Income Project. And like I said, some early findings. I might go kind of fast through the slides, just it's a smaller group. So I want to prioritize conversation and questions. But of course, let me know if there are questions about the content, and I'm happy to expand on things. So I just want to start again with an overview of direct cash transfers. I like to think of direct cash transfers as an umbrella term for these other cash transfer programs. I think a lot of times we use these things interchangeably, and there are some important differences. So what I want to focus on today is just the difference between conditional cash transfers and unconditional cash transfers. This side of the umbrella, the conditional cash transfer side, programs that, I think maybe all of us or a lot of us in here are social workers, programs that we're pretty familiar with, things like temporary assistance for needy families, general assistance, and supplemental security income, or SSI. And then on the other side of the umbrella, we have these unconditional cash transfers, programs like universal basic income and guaranteed income. So just to hit on okay, conditional, unconditional, what is that difference? And it's exactly what it sounds like. So conditional cash transfers, they have conditions on them, right? So things like work requirements or proving that you're looking for work, restrictions on income or savings. So something, again, that we're familiar with, that cliff. And so you get a raise at work and now you lose access to some of those public benefits. There might also be conditions like service engagement. So going through financial literacy courses or engaging in case management. And then also treatment engagement. So, accessing mental health or substance use treatment. And then we often hear these, conversations around drug testing. Should that be a part of a condition for public benefits as well? On the flip side of that, like I said, unconditional cash transfers, no strings attached. So there are no conditions to continue to receive that income once you start. So when we started kind of, thinking about guaranteed income as a response to homelessness, we wanted to get what do we already know, right? A lot of folks who are experiencing homelessness do receive government cash assistance. And so we conducted a systematic review. I won't go into the details of the systematic review, but essentially what we found 16 articles that look at government cash assistance as the intervention and had, what are the outcomes of it as an intervention, specifically for folks who are unhoused. And what we saw of those 16 articles all showed improvement in the target outcomes. So some of the outcomes included things like housing, financial security, mental health, financial well-being, and really across outcomes, there was improvement. So that, systematic review alongside a lot of other research shows that cash improves outcomes. However, there are a lot of barriers to accessing government cash assistance, especially for folks who are unhoused, but really for people in general. So some of those barriers might be documentation barriers, again, those income and savings thresholds, and work requirements. And then I just have some examples here below, things that I'm almost positive that folks on this call are familiar with, but for every 100 families living in poverty, just 23 actually receive TANF. Those strict documentation requirements can inhibit people who are unhoused from accessing SSI and SSDI. There are programs, the SOAR program, where we're just trying to get, navigate these barriers, but the barriers definitely exist. And then this last bullet point on there, it's I went back and forth whether or not to include it because it's not technically cash assistance, but it's really important for the conversation. Just, roughly 40% of people who are offered housing choice vouchers, or Section 8, it's often called, are unable to use it. And so the idea is that unconditional cash or guaranteed income can start to ameliorate or address some of these barriers that folks use, knowing that cash itself does have positive impacts for folks who are unhoused. Oops. So thinking about guaranteed income as homelessness, again, guaranteed income may ameliorate some of those barriers to cash assistance, and it really centers poverty as the root cause of homelessness. I want to emphasize here, sometimes I get questions like, what about housing first, and shouldn't that be the approach? And I want to say, yes, it actually absolutely should be the approach. This isn't like a one or the other conversation. This is knowing that the experience of homelessness is incredibly diverse, so therefore the responses to homelessness should be diverse as well. The other thing I wanted to highlight here, I have a link, and I'm sure I'll be able to share these slides so you can access it. But the Homelessness Policy Research Institute at the University of Southern California, I think maybe in the last 2 weeks, released some policy recommendations recommending basic income as a response. It's specific to the state of California, but that California should be using to address homelessness. And it really centers, there was a study at University of California, San Francisco, that surveyed a really large sample, I can't quite remember, a large sample of folks who are unhoused. And 70% of those surveyed said that an additional $300 to $500 a month in income would have allowed them to avoid homelessness. So just, again, really rooting poverty and lack of income as a root cause of homelessness. So finally, getting to the Denver Basic Income Project. So Denver Basic Income Project, I'll probably slip and call it DBIP at some point today, is a guaranteed income project for folks who are unhoused in Denver. It was founded by Mark Donovan in late 2020, early 2021. I always get those years mixed up. And what he did was really built a coalition around this idea. So brought in service providers, folks with lived experience of homelessness, and wanted to have a research element. So he reached out to the Center for Housing and Homelessness Research, which is one of the groups that I was working with while I was a PhD student, and brought us in the very early stages to help design the project itself, as well as the research to go along with it. It's funded, Leah mentioned this at the beginning, this kind of, a lot of these programs are privately funded. DBIP started as solely privately funded by, individual donors and foundations. In the last couple of years, the city of Denver has started to put money up for it as well. And so now it's a public and private funded program. So getting into the project design, you'll see me in the next 2 slides kind of try to pull apart the project and the research, and you'll see that it's hard to do that. One is really influencing the other, of course. So the project itself on here, I still have that it's 12 months. Like I said at the beginning, it's been extended for 6 months, but at the start, it was designed as a guaranteed income for 12 months for folks who are unhoused in Denver. There are 3 payment groups. Group A receives $1,000 a month. Group B receives $6,500 as a lump sum, and then $500 a month for the next 11 months. So those Group A and Group B, over the course of 1 year, they're receiving $12,000. And then Group C is meant to be an active comparison group, and they're receiving $50 a month. Ultimately, 806 adults we were enrolled in the project. We had a rolling basis, and so they were enrolled between the months of November 2022 to February 2023. I think it's like 85% of folks were enrolled in the first 2 months of enrollment. We use a very broad definition of homelessness. So I didn't go over definitions of homelessness, but any, folks who are familiar with like school social work or McKinney-Vento, that's kind of the larger, more expansive definition we used. So, folks who are literally unsheltered or staying in emergency shelters would be eligible, as well as people who are doubled up with another family for economic reasons or staying in a motel that they're paying for would also be eligible for DBIP. Another really important part of the project design was partnering with Denver-based homelessness service providers. So we partnered with 19 different organizations and really intentionally chose those partners to try to get a diverse group of folks who are unhoused. Denver, like most communities across the country, people, Black and Indigenous folks are wildly overrepresented in the unhoused population. So we wanted to make sure that the group that we were working with was at least as diverse as the unhoused population in Denver. So we worked with, for example, there's a safe outdoor space, which is essentially a sanctioned encampment that works specifically with the Indigenous community. And so we wanted to make sure we were partnering with them so their clients would be included. And then additional program elements, all participants received a phone and a phone plan. And then a UCO debit card. So people who were had bank accounts, the cash could go directly into their personal bank account. People who are unbanked could use this UCO debit card, and it's essentially a refillable, PIN-protected debit card. And then the research and design, it's a randomized controlled trial. So people were randomly assigned into one of those 3 payment groups. We used a mixed methods design. So, qualitative and quantitative data were collected. Quantitative data included a long form survey, very creatively named because it's long, at 3 different time points. So at enrollment, 6 months in, and then we actually did the 3rd time point about 10 months in, expecting the project to end at 12 months. We wanted to try to not capture information as the project was ending, thinking that there was probably going to be, heightened anxiety, et cetera, with that last time point. We also collected biweekly text surveys. So every other week, participants received a text and an email with a very short, 3-minute survey. A very short survey every other week. We were able to look at spending data. So for folks who use that UCO debit card, there was an extra element in the consenting process. They could consent to us looking at their spending data. What it essentially looks like on the back end, it's all in aggregate, but we can see kind of like what your credit card statement looks like, percentages of how folks were spending their money. And then the last piece, we are actively or right now working with the COC in Denver, the Metro Denver Homelessness Initiative, to look at HMIS data. So we do have some administrative data. I will say we just received that in the last 2 weeks. And so it won't be part of that final 12-month report, but we'll be looking at those data moving forward as well. Qualitative data, we did in-depth interviews with a subsample of 24 people, 8 folks from each of the payment groups, and at 2 time points. We worked with Marissa Westbrook, who's a assistant professor at Portland State, and she ended up, the retention was amazing. She ended up getting the same group of 24 folks at those 2 time points to interview, which was really exciting. And then finally, everything was voluntary and compensated. So just to be in line with the unconditional nature of guaranteed income, all research was voluntary. So somebody could decide, be a participant and decide, I don't want to do this research stuff. And that was totally fine. They were able to continue to receive their guaranteed income. And because it was voluntary, all of these research activities were compensated. It was just an extra amount of money that was loaded onto their card in the month that they completed the research. So target outcomes, we looked at a variety of outcomes, focusing, housing was kind of the primary outcome. And then we wanted to look at, there's a lot of things that happen around housing that might be, like proximal indicators of accessing independent housing that we wanted to look at it and understand as well. Of course, financial well-being, food security, transportation security is one that I'm really interested in. There was a brand new measure that I think it was published like the year that DBIP was starting. So we were able to include that in our survey, as well as these other outcomes. Oops. There we go. Okay. So just a quick overview of the participant characteristics. So as far as race and ethnicity, it really kind of mapped onto the racial and ethnic breakdown of the unhoused community in Denver, which, like I said before, that was really important to our partners, that we were at least as diverse as the unhoused population in Denver. Gender identity, I have this broken down as 50% were identified as women, non-binary, transgender, gender non-conforming. So 50% male and then 50% were these other identities. 10% were veterans, 49% reported a disability, and then 23% had children or people under 18 that they were caring for. So just some high-level findings. I do have some like graphs and quotes that I'll go through, a few of them anyway, but just high-level findings. And again, this is the interim, so just the first 6 months. More participants from all groups reported living in either rented or owned homes across the three, including Group C, that comparison group, roughly between 30 and 40% of each group. More participants in the larger payment groups reported having full-time jobs at 6 months, and fewer participants reported sleeping outside and using public health and safety services, especially emergency room and ambulance services. Just a couple more kind of those high-level findings. Participants in the larger payment groups reported feeling safer in their sleep locations at the 6-month follow-up. And felt more confident about their future housing. So there was a question that was literally like, on this scale, how confident are you that you'll access housing in the next 6 months? And so there was a kind of movement in that future orientation. And then on average, after 6 months, people in the larger payment groups felt less distressed and anxious, which really tracks with other guaranteed income projects happening across the country. They use services from their partner agencies less. So when I say DBIP partner agency, that's kind of the agency they were connected with when they enrolled. So we know that people access many services, but this is specific to that partner agency. And then I already mentioned this one, but visited emergency rooms fewer times. So I'm kind of tempted to stop there. Like I said before, I just have kind of, graphs, and I'm thinking that maybe I should stop for questions. Maybe if there aren't questions, I can go through these, but I think questions and discussion might be of more interest. But let me know if that's wrong.
That's great.
I'm going to stop sharing just so I can see folks, but if you want me to throw something back up, just let me know.
Do you have any sense of even a little bit of how they're spending the money? Because there's several different ways it could work. They could actually have more money to spend on rent, but they could also be able to utilize other services more efficiently and not have to spend the money on rent.
Yeah. So we do have that spending data, which is not perfect by any means for a couple of reasons. One of the main, one, it's just for folks who use the UCO debit card and consented to us looking at spending. So that's one limitation. And the other is they can use the card to pull out money. So that's the largest percentage that we're seeing, is that people are using it to pull money out of ATMs, which is fair, right? Cash. But other than that, things like food is really high up there, transportation. Those two are the main two. And I'm trying to remember it in I know that it's housing, and I can't remember quite if it's actually payments to land, like it's a little goofy with paying rent with this UCO debit card. But those are kind of the main buckets. And again, that's really consistent with other guaranteed income projects, like food, housing, transportation.
I have a question. Oh, sorry, go ahead.
No, go ahead, Ashley. You're good.
Do you know what percentage of participants were also receiving housing assistance? Like, was there a percentage of participants using housing choice vouchers or anything of that sort?
So we asked how, so one of the questions we asked was something like, where did you sleep last night? And there was like with a voucher. I don't remember the number off the top of my head, how many folks that was. We also had like transitional housing. So that was another option that people could use. And we didn't differentiate between vouchers. And we've learned that was kind of a mistake on our end. And so with the extension, we are asking specifically about housing choice vouchers versus other types of vouchers. So I don't remember the number off the top of my head, but I know we have kind of a differentiation of some different types of housing. I also, just some other options, tiny homes are an intervention in Denver. So that was an option. Those safe outdoor spaces, the sanctioned campsites. And then the other one, we have safe parking in Denver, which is one of my favorite interventions because it's so simple. It's a safe place. It's a parking lot where people can park overnight who are sheltering in their vehicle. So that was another option that people could actually choose from a list of where they were sleeping.
Awesome, thanks.
Yeah.
I was wondering if there was any connections between individuals having insurance and not having insurance, and also the intersection of the programs that they were utilizing and that they were qualifying for. So not just what they were utilizing, what they were actually accessing, but what they were actually able to be qualified for.
That's a really,
a bunch of different things. And just to preface that, I asked that because when we I co-facilitated a structural competency webinar with a interdisciplinary thing. So social work, PT, OT, all the helping professions, right? So one of the best types of reports we can use was the homeless point in time report, because nobody knows how many individuals are dispossessed or unhoused. And we saw these really interesting connections between single mothers of color with mental health disorders, single mothers of color with mental health disorders that were actually survivors of let's just say DV or IPV. And then on the male side, we saw individuals of color, of course, because those are the individuals who are the most dispossessed, where I am in Jersey. But then you saw these other interesting intersections, right? Many were not just diagnosed with mental health disorders, but some had other comorbidities. HIV was one of the ones that popped out, right? And you would kind of assume like men having sex with men when you look at some of those other intersections, right? But we couldn't look at who were presumed eligible for like Medicaid, who would then qualify for that supportive housing, who would then qualify for all those other programs that the housing vouchers in the Section 8 doesn't get to. So I'm just wondering if you all, even if you don't know it yet, are you tracking and collecting data in a way that will allow other researchers to even look back at that?
So the one way that I'm thinking we might be, which is again a not perfect, so we are using that HMIS data, which so I'm from Reno, Nevada. When I was a practicing social worker, HMIS was like not a great data set at all. I think Denver is a little bit better than, at least from my practice experience. And I haven't had a chance to really sit with the data yet. So I think that might be, it's our only like administrative data set that we're looking at. Other than that, it's all survey data. So it's all self-report. We do ask folks if they had any change in benefits. Because one of the things we were interested in, like, you know, how many people are losing, we're not asking why, but like potentially losing SNAP or losing, you know, these other benefits because of the guaranteed income. So we're asking about change in benefits, but I'm trying to think, I don't know if there's a way to, I love that idea of like pinpointing these intersections of qualifying for benefits, for different benefits. I'm not sure if we have a good way to do that. Unless HMIS looks, is super helpful and yeah. We'll see.
I think Vince put a question in the chat. Using the broad definition of homelessness, do you have a sense of how many were coming in were doubled up situations and how many more were in a literal, not my preferred term, homelessness situation? Do you expect any differences in the trajectories in the program for those two groups?
Yes, absolutely. So one of the exciting things that I'm looking forward to is like a whole lot of subgroup analysis. And one of the big ones is this like unsheltered versus sheltered at enrollment, and what those different trajectories might look like. I will say the majority of folks were falling into that more sheltered homeless definition, which is not surprising, right? Like we would expect that for most folks who are experiencing homelessness are in more of a sheltered location than an unsheltered location. But yeah, I do expect there to be differences and trajectories just on the precarity of where they were at the start, right? This is, and now I'm like, do I have this number in my slides? I should have pulled. I have a table that has all the percentages of where folks were staying at those different time points. But I don't think I have it super handy, but I do off the top of my head, I know that staying with friends and family members was like one of the top, for economic reasons, was one of those more common experiences for folks.
I see Dr. Sheridan came in after we did introductions. Welcome, Dr. Sheridan, and I see you're off mute if you have any questions or comments you want to throw in.
For the quantitative data, did you do some significance tests?
Yeah, so as of now, we've just done, and this is more in the 12-month finding, which I'm like, we're like so close to being able to share it. So we do have just simple like, you know, t-tests and chi-squares is kind of where we're at now. We'll be doing fancier things into the future for peer-reviewed publications, but just focused on that report for the community at this point. Mm-hmm.
You know, decades ago, I did a long, intensive study with in Austin, Texas, with people who were panhandlers, you know, at intersections. And that population at that time was much more heavily veteran, which so there were almost a third of the group that we got through this highly randomized process had some kind of military experience. And then it led us to ask what were the other background experiences that might have really brought people there. And so there was a big group of people out of the military with less than honorable discharge. So they had very little access to benefits. There was another group of people that had been emancipated from Child Protective Services when they were 17 or 18. And there was another group of people whose families of origin had been chronically homeless. And I didn't know whether you were getting in some of your more qualitative work some sense of, are there trends in our society and institutions in our society that are essentially exacerbating this?
Yeah, I think so from our study, one of the qualitative pieces that's coming out a lot is it's more in changes it or conflict with family was one of the things that, and I will say before I say that, it's not a specific question that we asked was about like kind of tell us about what led to your experience of homelessness or being unhoused, but that was something that came up kind of naturally through conversation. I think there's a lot of research outside of our study that does like absolutely a lot of the institutions that we have exacerbate, you know, foster care. There's a big link between foster care and being unhoused later in life. And so, yes, not necessarily from our study, but it just in the area for sure.
I had a question. I'm newer to this space, so I apologize if this is stuff that everybody else here already knows, but just from the article that Lena put in the chat, and I actually grew up in Denver, so I know that the new mayor has been, you know, apparently a supporter of innovations to support homeless communities, but I think that's controversial. And so I'm curious, kind of just like in the political environment, what you're seeing around all of this. And also, as I mentioned, I focus on faith communities and their role in supporting unhoused communities. And so I'm curious if you have any thoughts on like potential space for faith communities to step into this space as well.
Yeah, absolutely. Yeah, the political climate has been interesting in like a surprisingly quiet way in Colorado and Denver. There has been more support for from the like institution, like the state legislature. Like I said, I think it was COVID did funny things with like timelines. I think it was last summer that they invested $2 million and then they just added another $2 million into their budget. I will say they initially had said 4 million and they brought it down to 2 million. So there is still like, obviously they're not like jumping in with both feet, but there's a lot of support, especially compared to other communities. One of the kind of, so Mark Donovan, who I mentioned before is the founder, he's been really good about talking to both sides. So he like is a regular on one of the conservative talk shows in Denver, kind of talking about guaranteed income, talking about this, you know, we need more. Obviously, this is a huge issue in Denver, so let's try something that's new and creative. And I wonder how much that's kind of helped push back on that narrative that is definitely prevalent. I'm not going to say everyone is like, you know, super excited about this in Denver, but just I think that might be part of the reason why we haven't had, knock on wood, this huge backlash that a lot of communities have had. And I do think that part of it is like this idea that, you know, the tech community has gotten behind guaranteed income a bit, right? And I think part of that is it's, you know, people are seeing automation of jobs. And if we want capitalism to continue, people to have money in their pockets to spend. And so talking, like using that narrative as well, which, you know, we might have feelings about, but I think that's another piece that Mark has been, I don't know how strategic, like how intentionally strategic he's been with that, but it's definitely, I think, placated some of the concern from maybe more conservative minded folks.
Yeah, and then just to ask the second part again, if you don't mind, I'm really curious if you've seen any initiatives within faith communities or any space that you, because I'm always kind of curious about like in a legislative environment where cities and counties are prohibited from doing certain things, are there potential legal loopholes for faith communities to take advantage of?
Yeah, thank you. I'm like tempted to, I don't know. We haven't, so the safe parking project, that's like all led by faith community. So I worked with a lot of churches, like I think all of the project or all the locations were churches for that safe parking. We haven't worked with churches that I know of through the Denver Basic Income Project. So I don't have a great answer for that specific to guaranteed income, but I think it's a really interesting and important kind of perspective to take on this work for sure.
I don't think that, so I work with a few pilots too, and and I think the general consensus is that these bills are not going to stand up in court, right? If someone's doing private philanthropy, you can't tell them that that they can't put strings attached to that private philanthropy, right? I think the biggest fear is just that the time it'll take for that to work through the courts will slow down a lot of the momentum, will slow down some project timelines, that sort of thing. But I think your question is interesting. What can the faith community do? I think, being involved in these legislative conversations that are happening right now, I think would be really helpful.
Yeah, it just strikes me as a really interesting opportunity for a lot of communities that are looking to do more. And it's definitely a conversation I've tried to have in congregations that I've been involved with. If you want to help, really putting money directly in people's pockets is the way to go. And yeah, you got my wheels turning. I appreciate it.
I think it could have really big implications on, private churches, right? So what churches do with their funding, and I think there's lots of legal implications that this could have for private organizations. Yeah.
Yeah, well, and even so, the reason churches were big in are big in the safe parking is because they were able to. So there's camping ordinances in the Denver area, and that's why it was illegal, right? You can't camp in your car overnight, and so the churches were saying, like, this is part of our work with the community is having this space, and so yeah, that is an interesting. Yeah, it's just an interesting question.
We have about 10 minutes left. So I want to keep it open for conversation. Also, Katie, I don't know if you want to drop your email in the chat in case anyone has follow-up questions. I want to open this up to any more questions you have on this specific topic, but also, as this is the last working group meeting for our grand challenge for this academic year, but we are very interested in how we can better serve the community, the social work community at large, folks who are interested in reducing extreme inequality. And if you have ideas for our next series in the coming academic year, we're always open to it. So I'm happy to drop my email, or you're welcome to bring that out here.
I wanted to raise a question that Quincy had in the chat about what kinds of experiences people had with working and workforce and what the implications were. Because one of the things that in my study a long time ago was that the large majority of people were trying to work or working at least some of the time. And it was not that they were totally unemployed, but the nature of the employment that they were getting wasn't restorative in any particular way.
Yes, so we didn't ask for we have more of the, how has or what's your current work situation? And so I do have one quick slide. And in our report, we have more than just full-time employment, but this is just looking at full-time employment. So that was one of the boxes that they could check, what's your employment status right now? And so at enrollment, it was about 20-ish% of folks were employed full-time. And then we saw increases in groups A and B, and group C stayed about the same. And so, like I said, I have, other options like employed part-time, getting, being paid under the table, those kinds of different ways we get income. And so I don't have those numbers off the top of my head, but at least just with full-time employment, we are seeing actually an increase in full-time employment after the start of the program. And if I can just say one more thing, there's also the SEED study with our first part of the study anyway, did see also an increase in full-time employment. And the reason why was, folks shared that they were able to not just be doing gig work and just kind of have the space to focus in on just getting one full-time job rather than working, all the Uber, DoorDash, all those things, as well as having space to do a certification program that then led to full-time employment. So just opening up space and flexibility to do this kind of, to move into more full-time employment.
Just a last follow up on the workforce implications for helping professionals, right? That overlap between helping professionals and clergy and the faith-based movements, right? How many of those opportunities exist to actually create and sustain jobs when we start looking at conservation corps, when we start looking at things like WPA programs, when we start looking at enhanced apprenticeship programs, right? I think that sometimes we look at these quote unquote problems, even though they're symptoms of other problems, but we're not talking all about policy today, right? What are the implications for the future of the social work workforce around those things that we already know are going to be there, right? Some places may say the poor will always be with us, right? But there's also some things that we can do about those folks who may be on that less fortunate end of the spectrum. So what sustainability and follow-up opportunities are possible from the study that you're doing right now? That's a year, but of course those people are going to be there long after this, right? So are there any implications that you see there, and any indications of some possibilities of positive sustainability and funding coming your way, or is that still something that we all have to research?
A little bit of both. I would say that's like probably one of the number one questions is like, okay, but what happens afterwards? Like similar to any other, cliff of program ending. For the Denver project, like I said, they've extended it for 6 months. Mark is like actively fundraising to extend it beyond that, but it does feel like this constant like, okay, is it gonna happen? Oh, okay, we got the funding. And is it gonna, and so it does. I think once the project does end, assuming it does end at some point, like we have to do follow-up research and kind of get a sense of what's happening with folks after the project ends and see if there is a lasting impact. And I know this conversation is happening well beyond the Denver Basic Income Project. I think probably most programs are looking at that as well. And what can we understand about any lasting impacts across outcomes is incredibly important. And as far as I know, Liam probably has a better pulse on this. As far as I know, I don't think there are any kind of findings from longer term programs anyway.
There's not like post follow-up. There was Give Directly recently came out with some research like 10 years after an intervention in Kenya that had kind of mixed results. I can't remember what it was, but it was like, 10 years after you help someone in economic precarity, like surprise, that didn't like change the entire course of everyone's life. And I think it's a really interesting theoretical question. I get asked this too, like, are you going to follow up with people 12 months after the program? Like right now, there are 150 guaranteed income pilots across the country, which is super exciting for the movement. But, the future of economic security in the US does not look like a patchwork of pilots, right? So hopefully we're moving towards federal legislation, and hopefully that legislation is permanent. So, I'm always interested in the intention when people ask, like, are you going to follow up with people afterwards? Like, what's the, the theoretical argument for doing that? Is our hope that just doing a temporary intervention in someone's life will, mean they never need support again? Is that how, human beings work? And then is that like, and then let's say that people aren't doing so great 12 months after, 2 years after, because life happens. Is that building an evidence base that, guaranteed income doesn't work, so we shouldn't support legislation? I think we really need to like collectively ask ourselves, are we building an evidence base for a permanent policy or for a temporary policy? We have about 3 more minutes. Final question. Okay, well, I'm so grateful to Dr. Calhoun for making time for us today, and for all of you for coming. This was such a great turnout. We'll make sure that this recorded presentation is posted on the Grand Challenge YouTube channel, and and hopefully have more exciting presentations in the coming year. If there's anything you're really interested in hearing about, let us know. We're happy to reach out, make connections, so that this group is really thinking on the forefront of reducing extreme inequality. Thanks so much, everyone. Have a great week.